All right, we'll go ahead and get started, Sierra. Awesome, wonderful. Welcome, everyone, and thank you so much for joining our fireside chat on shared stewardship, the spirit of hope. I am Kamal Rosby, and I serve as the Associate Director of Systems Change with the ReThink Health team. We have a very great time planned for you all today. Here's what we have on the docket. We are going to have our fireside chat with our dynamic duo of Dora Barilla and Dr. Paulette Brown-Hinds, both of whom I'll introduce in just a moment. We're going to discuss shared stewardship and bridging differences and why it's so critical now more than ever before. We will have a Q&A session towards the end. And throughout the session, folks from the ReThink Health team will be sharing helpful resources and links via the chat. So keep an eye out for those. And of course, as always, we'd love to have you engage with us. So feel free to use those Zoom reactions. Feel free to use the chat as we share space together today. Before we jump into discussion with our guests, I want to take a moment and ground us all in what we mean by stewards and shared stewardship. I welcome you to check out the content from our previous Toolbox webinars on this topic, which will be shared in the chat. So stewards, who are stewards? Stewards are us, all of us. Stewards are people or organizations who work with others to create the conditions that all people need to thrive, beginning with those that are struggling and suffering. We as stewards, we have or we want to develop an equity orientation in regards to purpose, power, and wealth. Stewards work on the front lines, actively building consensus and encouraging cross-sector collaboration that's necessary to create lasting change. So everyone can be a steward, but no individual or institution alone can create the kind of change that's necessary to support everyone's ability to thrive. And that's why shared stewardship is the key to progress. What is shared stewardship? Let's look at the next slide, please. So the fundamental principle of shared stewardship is that an equitable, thriving future is possible if enough of us as individuals and organizations across sectors, if enough of us see ourselves and each other as interdependent stewards in a movement for well-being and justice. So if we see ourselves as a team rowing towards a common goal. Stewards like each of us here, we possess enormous capacities to transform our current and future conditions for better or for worse. And that is important now more than ever to think about how we want to shape our future. What is the future legacy we are leaving for as ancestors? Particularly now, because change makers or stewards across sectors are up against an array of political and social threats to our collective health, to our autonomy, to our safety, and our economic well-being. There's no denying the mounting frustration, the division and the hurt and the fear that's spreading within our communities and across our nation. And I'm sure you're feeling it in very different ways where you stand. And this moment calls on us to embrace the principles of shared stewardship and demonstrate our commitment to bridging differences, to finding common ground in order to secure a future where everyone belongs. In short, now is the time to step in and not step back. And that's what brings us here today, to explore the ways that shared stewardship practices and bridging differences can help us navigate this current environment, to come together in the spirit of hope and recognize the strength that we have in numbers and through interdependence. And with that, let's dive into our discussion section and get to know a little bit more about our guests. So Dora Barilla, as president and co-founder of HC2 Strategies, is part of a growing network of stewards who are working to reimagine a healthier world, to bridge divides and advance systems that support community well-being and population health. And Dr. Paulette Brown-Hinds, founder of Voice Media Ventures, is the second generation publisher of Black Voice News. She is transforming the half-century-old weekly print outlet into solutions-oriented data journalism and justice-focused community news organization. As the publisher of Black Voice News, she has continued her family's legacy of using media as a tool for social change in the Inland Empire in California. Dora and Paulette, I can't thank you enough for being here today to join us fellow stewards in conversation. So Dora, I will ask you our first question. And for our audience, feel free, if you have questions, feel free to include those in the chat, and then we'll circle back to those during the Q&A portion. All right, Dora, are you ready for the hot seat?
I'm ready, Kamal. Let's go.
Okay, so Dora, what does shared stewardship and bridging differences mean to you, and why do you think it's so critical now?
Yeah, well, thank you, Kamal, and thank you to the Ripple. I can't think of something more that I'd want to be a part of today than the spirit of hope, because we really need to lean into that. Hence, what really stewardship means to me, and why I love the language and I love the growing movement. It's really about collaboration. It's about a solution-centered, really looking at the possibilities of working together, focusing in on the abundance that we have. And, I just want to share a story of when I first started my career to why it's so important today. I'm a doctor of public health, but I spent about 30 years in hospitals and health systems. And when I first, so one of my first jobs, I'll never forget, it was right when the tobacco tax, just came out in California, really looking at maternal child health. And, we were looking at some of our programs, and the public health director said to me, "Dora, you're doing public health." And I remember saying, well, Betty, don't you think we all need to work together and collaborate, because it's all public health? And she just got such a kick out of me. Here I am, this young 20-year-old, but it really was about working together and collaborating, knowing that we can't work in silos. And so 30 plus years later, I think what does stewardship mean to me is really, bridging across all the different sectors that create health. We know in a hospital, you cannot do it alone. We cannot address what's happening in our emergency departments alone. Public health departments can't address, what's happening in our communities alone. It's about coming together. Why is it so important? Because I think we're at risk of, really deteriorating on some of the health and well-being of our communities. And we need to come together. We need to look at all the different perspectives. With the polarization is going to kill us, and the stewardship and collaboration will heal us. And so I think it is a moment in time and a strategy that no one can disagree with. It's an opportunity to harmonize and heal us, and to look at how we're doing collaboration and really learn how to do that a lot better, and really come together with different sectors, like my colleague Paulette. I'm a doctor of public health and she's working in media, but I feel like we're working on the same thing. She just has a different perspective, and it's a lot more life-giving as well. It's very generative. So I just think it's a critical resource and tool for us in this time, and especially, there's no such time as right now to be practicing shared stewardship.
So well said, Dora. The harmonizing and healing is something that really will stick with me. So thank you so much for that perspective. Paulette, what about you on shared stewardship and bridging differences?
Yeah, thank you. And thank you also to my colleague, Dora. Dora and I, until I guess the last month or two, served on the board of the Inland Empire Community Foundation together. I had been on that board for 10 years and just termed off. And Dora, I think you're still on the board. We can't lose you. We're still on committees together. Yeah, but I learned a lot of the language around shared stewardship, and also just the framework of the vital conditions. Learned it through Dora and her work on the Community Foundation board and bringing that to the board. And as I built out what I'll talk about today, the the journalism hub that we founded and incubated at the Community Foundation, you know, the language of shared stewardship really resonates with me in the work I do, even though I was not familiar with the language until I was introduced by Dora. So when you talk about interdependence and, you know, working collaboratively, multi-solving, all of these things are like the things we were doing, and as we were building out the hub, are really kind of spoke to the work that we had already started to put in place. I'll just share, I know in my bio, you know, you shared, I am a publisher, second generation publisher of a community news organization. Everyone knows, you know, the news business, especially is in crisis. And I'm right now in Miami at the Night Media Forum, which is an annual event where we talk about local news, how to support local news so that we could provide vital information, of course, to our communities. So as a community member, as a member of the board of the Community Foundation, I helped launch our journalism fund and hub. And really the way that we're designing that work to really strengthen the information ecosystem of our region is really built on those principles that we talked about. So for shared stewardship, for me, is very similar to Dora's comments around collaborative. We are taking kind of a collective approach. We all know the harms of disinformation, misinformation, and really how it's harmed so many of our communities. Is, you know, it points deadly without having the accurate and vital information that you need. And then, of course, with the rise of social media, and we now see with generative AI, you know, spreading misinformation and disinformation faster and wider. So we brought together media partners and other closely aligned organizations into this collective through our journalism hub. So we have media partners who are either single shop, small organizations like ours. We have academia. We have other content creators in our region bringing together to really look at how we strengthen our local news ecosystem. And so for me, the ideas behind stewardship are really important as we build this collaborative, all of us understanding that we're stronger together than when we're trying to do this on our own. And so it's been great to see this group that we're working with really identify and support that kind of thinking and work together to strengthen the ecosystem. So for me, it's that interdependence is important. Figuring out how to work collaboratively for this towards larger goal, like really looking at how do we not just change the system of local news and house provided, but then also what we're reporting on. So I know we'll talk a little bit more about the vital conditions, but we're building a lot of a work around the vital conditions, and our beats are kind of organized around vital conditions. But we're excited about, you know, the work we're doing, and to have the support of the Community Foundation and folks like Dora, who are on the board, bringing these kind of resources to us has really been beneficial.
Thank you so much, Paulette. Yeah, it's very interesting to think about the role that media plays in constructing a unifying narrative. So much power in that. So, Dora, coming back to you, what are some of the challenges that you're facing as a steward promoting shared stewardship and trying to bridge differences right now?
Yeah, well, Kamal, I think, you know, just Paulette mentioned that we're working in the Inland Empire. It's one of the locations, and this is a part of Southern California. So if you can imagine, there's just so much diversity, so much in Southern California, and you know, as you're looking at this whole concept of inclusion and belonging, and really starting with those that are struggling and suffering, is such an important really model. So some of the initial challenges, just going back to my original story about, Dora, why are you doing public health? You work in a hospital, is around new mental models. What are mental models of really working and collaborating together? Years ago, people would say, well, why are you working with the media or a journalist? And today, I think we can say, how can we not work around a unifying narrative? So I think that really, and we can't undersell the importance of new mental models, bringing in new shared language. Because if, really what stewardship is that everybody has a part in really healing community. Well, everybody has different life experiences, not alone in different agencies. They have different language. As we started working, just public health and hospitals now seems like a natural alignment. But then also thinking about, how do you work with cities? How do you work with the housing industry? So having some of those shared language and models that you can galvanize around, I think are some of the biggest challenges that you really need to really think about. What are the new practices of coming together? Because you don't often have shared tables. Paulette and I were really lucky with the Inland Empire Community Foundation to have Michelle Decker, who is the CEO, who instantly braced the model of stewardship in vital conditions. She just saw that this was a framework that we could really build community around, because there was a lot of divisiveness. Here you had a somewhat traditionally conservative region in California, but then you had exponential growth, and she really needed to find a way to bring people together. And so I think it really is, just our years of polarization, our years of, trying to compete for dollars, our fragmented funding, that there was nothing that incentivized really a shared stewardship model up until recently. I mean, you can see that's really starting to shift and to change, because everybody thought it was their piece of the pie, or their particular sector. When you look at an integrated model, it takes a different way of thinking. I always say we need new neural pathways in our brain, and really building trust. When I first started working with cities, they said, well, what do you want to do? Build hospitals? And I said, no, that's the last thing I want to do is build hospitals. I mean, we might need them, but, I think that really the reality is, do people have access to health? And that's not always a hospital. So I think it's really, some of the challenges are that people aren't talking across sectors. They're not having a common narrative. They're looking at differences versus really pulling each other together. They're not thinking of necessarily short-term and long-term solutions. And it's not comfortable to break from business as usual. Having, maybe a community organizer sitting down with the hospital CFO, that takes some bridge building. That takes some trust building. So yeah. I think, just really, those are some of the biggest challenges. And I just can't undersell enough the importance of really having the language, the mental models, and really conversations like this, so people can understand what does shared stewardship mean.
Oh, absolutely. The point about there's an opportunity cost to not working together.
Yeah.
And in this moment in time, we don't have the luxury of staying in our own circles. So coming together is incredibly important. That's a great point. Paulette, are you experiencing something similar? What are your challenges as a steward?
So actually not yet. I would say not yet. So when on the hub in particular, and I think there's like two parts, right? There's the work that we do with the group of media partners and other partners that we've convened and that we're starting to work together. And our effort is really about 8 months old. So, and hopefully, I don't know if they dropped in the chat a link to our hub website, just so folks can see it. But there's also like we call it our annual report, but it's really like our 6-month report of what we've done. We've done a lot. So there's the work we did internally. I can speak to that, but then there's also like the external, like community work that drives also what we're doing. You know, because when we started working together, you know, we realized that, you know, we're like, we believe we're like the information providers for our region, and we providing information to make our lives better. We are helping people make sense of the world around them, what's happening around them. We're also like holding those empowered to account. And then we're like these trusted messengers. We talked a little bit about trust. We're we talk about not trusting like national media, but local media has a lot of trust, and we're like embedded in community in a way that other media is not, right? So we have this level of trust. The challenge has been in bringing these groups together who had normally maybe seen each other as competitors in a way, right? Like you're, trying to beat the other newspaper to the story, or the new media company that's now in your town, you see as a competitor. So part of the challenge is like we all need to work together. And I have to admit, in the first couple of months, like I said, we've only been now working together really 8 months. The first couple of months, it was a kind of a little question, like, how are we going to work together? We quickly got over that. And everyone, I believe that we brought in, we talk about, is it generous exclusion? Like we made sure that the right folks were in the room so that we quickly able to kind of jump over that hurdle of like the challenge of competition versus collaboration. So that has gone well, but part of the work we've been doing too is in town halls and in meeting with community. And that's, I think where we talk about that polarization that Dora talked about, like communities see things very differently, almost in a way that's kind of competitive, you just don't agree with folks and you don't want to even speak to them and see where you can find common ground. So that is, we launched in a town that's a little more conservative in our region. And it was interesting to hear what information they think is important. We did like kind of boards where we asked, what news do you want? What's missing? What haven't we, what are we not talking about? But I think what you find, especially in communities, is there's certain things that people kind of want the same thing in a community, right? You want good school for your children. Dora talked about healthcare. You want to know that if you have a problem, you can see a doctor or there's a hospital close by, right? You want the roads to be certain. We want parks. So I think there's a way that as local and community media, we can actually do a better job of finding that common ground. So that's the thing that we've been working on. It's a challenge, but it's the thing that we're like thinking about, actively thinking about as our own collaborative. So within the group, it was like, how do we work together and not see each other as competition? And then the other part of that is, how do we then engage with community so that we can find common ground, right? And not focus on those things that polarize us, that are like these national issues or things that, we've been told that we should care about. What are things that we actually care about? And then you find that there is common ground within community. So it's been important that we've had these kind of town halls as a part of our first 6 months. And those are the big challenges, I think, for us, more than anything.
Thank you so much, Paulette. One of the things that we talk about here at ReThink Health is the concept of growing the pie, right? Instead of, oh, this person is taking a slice from my pie and there's a finite number of pies. Well, what if you grow the pie, right? And that's something that we can collectively do if we could just shift out of the zero-sum mindset. Because we tend to do that when we put on our human first approach to things as opposed to, the turf wars that we see all around us. Okay, so
Oh, can I
for
just
our,
add, can I just comment? Somebody in the chat, I'm sorry, we looked in the chat.
yeah.
That idea of unifying around shared values, I think that's where like the vital conditions comes in, and it is unifying. Like everyone wants humane housing. Everyone wants meaningful work and wealth. Everyone wants a thriving, like there are things that we all,
Mhm.
and so that's been really helpful for us to be thinking about that as we're building and not as an afterthought. So I didn't want to cut you off, but I just wanted to acknowledge that. Thank you, Tara, for that comment.
Oh yeah, absolutely. Sometimes you might have to search harder for those commonalities, but they're there. You might have to zoom out a little bit at times. So for our next question, there's some context around it. The ReThink Health team has done deep research on the types of practices of stewardship that are the most transformative. We call those the essential stewardship practices. There are 15 of them, and they are going to pop up on the slide here and also be shared in the chat. So, Dora, what are some of the most important stewardship practices that resonate with you in this work?
Yeah, so thank you, Kamal, and there was a question in the chat too about just whether or not these practices can be built in an individual or collectively. And I wanna really tie that in, because I think it's, in terms of, what you need to move forward is clearly leadership and space. You need some space. You need somebody that's going to adopt this. But it'll never work unless you have a collective that adopts it with you. And so in terms of what's really needed is that trust. That's one of the most important things, that this is going to move at the speed of trust. And we, what some of how we started and launched this work was we did our community health needs assessment and our community health assessment with both the hospitals and the county and our managed care plans. We did our community health needs assessment around the stewardship and the vital condition model. So, that was really an important tool to to address and to utilize. And so I just wanting to share that those that common language, and like Paulette said, it gives people a framework to really look at. And going back to your question about what are some of those practices, I mentioned I lay that foundation for the community health, the vital conditions, and really starting to look at your community's health through that lens was really important, because that allowed us to weave vested interests, which is one of the practices, that everyone could see what's their role in housing. Homelessness is a perfect example, because it's so often you see people that are experiencing homelessness showing up to the emergency departments, yet they don't have any resources or tools to address that. So the pain point is really looking at, your housing ecosystem and your homeless system providers, and you usually don't have that. So how do you really build that and begin to strengthen that interdependence on how they're looking at things, so that looks at requires some cross-sector case conferencing. So you have to really, in addition to just doing that, really making it practical in terms of having some practices that really support that, not just in words, but in practical tools. And as Paulette mentioned, I think expanding our aspirations of really looking at what's the story and what can we all do together if we look at not just slicing off the pie. My favorite is introducing the concept of multi-solving. Really committing to that. Most people would say, well, what is multi-solving? And some people say that, but do they really know what that means? And adopting those principles of co-design from the different perspectives of a community, and learning how to make meaning, and having those partnerships really become important. And I think asking the question around our past legacies and then our future. And I think there's never a time, I mean, we all need to stop right now and say, what's our future legacy going to be in response to what's happening in our ecosystem of health and well-being? And, I think that's an important thing. So just that multi-solving is so important. And then, and we can see this now, is rather than fighting over our investments, really looking at how do we align those? And then having some common data measures. Everybody wants to do a dashboard. Everybody wants to do their, collect their own data. And so how can you get some new tools and resources to look at data? And, I think a lot of it is, looking at the complexity of pulling together and helping people to feel comfortable with embracing complexity. Again, my experience has been a lot in hospitals, and, most CEOs are not trained around multi-sector partnerships or complexity. It's very linear. You've got to focus in on, the quality and the finances of the hospital. But really looking at how do we allow people to feel safe in a space that we can embrace that. And, we can really think of data in a way that really serves us all. So I think there's lots of practices that we need to look at. But those are some of the few, Kamal, that I think are really important.
Thank you so much, Dora. You braided those together very, very well. Paulette, what about you in terms of the stewardship essential practices that resonate with you?
Yeah, and thank you for sharing that list with me. It's funny. Dora talks about the work I do, and she's like, "You're you practice shared stewardship. You just don't know it."
Yep.
So I'm like, okay, let me look at the essential. What resonates, and I just think of even the way I kind of move in general, not just with the hub, even though I'm speaking to that today. But the things that I think resonate when I really looked at it is that idea of strengthening interdependence is one, and even in the way we decided to work on the collective, it wasn't just here's a hub. We're like, what are the strengths of all of the partners, and then also how do we build on that? And in the chat, someone asked a question about the skills, if these skills can be built among the many. Like one of the first sessions we had was people thought it was going to be about media, but they didn't know exactly, or journalism, and it was really about leadership. Like a first session, and they were they're like, what, if you said that in your invitation to this meeting, I don't know if I would have come. And we had one person who said that because they thought it was going to be like a more specific business talk. And it was more about just kind of leadership. And some of the ways we talked about it are really in the language of shared stewardship. Like I said, we just did not know at the time that there was this framework that we were really in alignment with. And even the way we're working on strengthening individuals as we build the collective, and having them contribute to the future of this entity that we're building to support, once again, the information ecosystem of our region, is really that attribute of or principle of strengthening interdependence. That idea of building shared power so that we're all working together toward the shared action, and helping to bring in others, which is what we're doing with those town halls, resonates with me. The idea of changing the narrative, or changes, like I think it was something about storytelling, but thinking about the ways we talk about changing the narrative. And part of the work we're doing is focusing on solutions, right? Too often it's like pointing out, especially in news and media, pointing out the problems. So we're like, how do we uplift the solutions that we're seeing, right? So that's a kind of a solutions journalism lens. We're doing that, and I think that's part of that, changing the narrative, especially around our region. As Dora mentioned, that continuous learning. I mean, change is constant, and we know that, and so this need to make sure that we are not stifled by concerned or fearful about new technologies. We're talking about that here in Miami, and like I said, I'm not the only one as a part of the hub that's here, but embracing new technologies and then using data to chart progress. If you go to our website, you see a link to that report, one of the first things we did was we mapped the infrastructure to have an understanding of what our infrastructure really looked like. And now we're working with a team of researchers at one of our universities so that we could chart our progress. And so we started with, here's our kind of baseline, and now we're digging into the data. And I think that is so important to be able to show impact. And that's one of the things that we know, we need to do. So those are things that resonate, when I look at that list of essentials.
Yes, thank you. Both of you mentioned data, and that's just so critical, especially knowing that our sources of information these days are being changed, or our access to them, making it even more important to, well, we can't just look at data just to look at data. We can't just gather data just to gather data. We all are busy. We got better things to do. We might as well work more efficiently and, really do the other end of the equation. We tend to focus on, oh, this is going wrong, and that's going wrong. But then we don't complete the equation, which is, and this is what needs to change so it can look like this, right? And the different parts of the essential stewardship practices really do lead you to that. Like, you can't come to the table and not weave vested interests. You have to make my problem our problem and vice versa. So thank you so much, both of you, for participating in this chat with me. I want to open the floor for questions. At this moment, if you have any questions specifically for Dora, since she will need to hop off shortly because stewardship calls, I welcome you to unmute or share in the chat, and then we'll have questions, time for questions with Paulette. Any questions for Dora? Richard, I see, thanks for sharing that we can't just look at the data. We need to take action with the data. Yes, yes, and yes.
I was going to add on that question. Thank you for that comment, Richard. One of the things that, on the news side of what I do, we actually have a small data and mapping team. We're probably the only community newspaper in the country that has a dedicated data and mapping team. And so one of the things that we recognize, especially when it comes to data about, Black Californians, is what we are focused on, is that people don't know how to necessarily access it all, and especially organizations that are doing a lot of systems change work in our state. And so one of the things we did through the Community Foundation, we have a Black Equity Fund. We are now, we just received a grant to work with those organizations to help them not just access the data, but be able to make it more actionable, like the solutions, so that they're data-driven solutions. They have the desire, but they don't necessarily have the funding as small organizations or nonprofit organizations. And that idea of taking action. So part of it is accessibility, but then also making it actionable. And it's one of the things that we've been thinking a lot about. So thank you for that comment.
Yeah, and I'll just, add, Richard, it's so important to really look at data and not only, what's wrong, because we are great at studying the leading causes of death and, what's wrong in our community. Couldn't agree more in terms of, making sure that our data leads to action, and that we're not in analysis paralysis forever. But also looking at what's going right. And where are we creating opportunities and really beginning to look at data? One of the, I talked about the Inland Empire mostly, but, another part of my work is working across the state on a lot of our, what we call Medi-Cal transformation. And it's really about bringing together, it's really a stewardship model. It's about bringing, different sectors together to really look at healing communities that are suffering the most. And, really starting to look at data that how are we creating opportunities with our data? How are we thinking about what are the assets in our community, and how do we begin to build on that? And so as you look at a stewardship model and you look at multi-solving, you also might have to really rethink the data that you're tracking for action. So often we look at, in healthcare, we call it the HEDIS measures, or, just other measures. And are they always the right ones? I was at a meeting this last summer, and someone said, are we tracking how many children are laughing in our community? And that just really stuck with me. I know that might seem like a soft measurement, but it just gave me so much inspiration and courage to think about data differently, and really thinking about, if we do want these transformational systems, what's the data that we need to be tracking? And so I challenge us all to really think about data in the time where a lot of data is disappearing. And, that's really frightening, but I think love looking at data that makes a difference, creates opportunities, and going back to my opening statement, that brings that healing and harmonizing in our community. So, a lot of the Medi-Cal transformation is beginning to look at data of building bridges and building those cross-sector partnerships. So I'm excited about the opportunity.
Thank you so much. That was such a great example. For everyone who's on these Hollywood squares, I saw a smile come across everybody's face. So, really wonderful example. Jane, I see your message. If our goal is to build new systems that don't exist now, we need to see new possibilities. Reframing measures in a positive way using asset-based framing is a great way to help do that. Absolutely. Otherwise, we'll keep doing the same thing. And you know what the definition of insanity is. And that's not us. So Dora, I know that you you need to step away and do some stewardship in action. Really quick, if you had to give all of us who are here in a team huddle, sheltering from the things that are happening outside, what would you say to us to encourage us before you leave today?
Yeah, well, one, just thank you to the Ripple Foundation and ReThink Health for having this conversation. But I would encourage you to be patient. When you introduce this concept, it's not like, oh, everybody comes on board, that it takes time. And so to come in community, I mean, I was really lucky to have Paulette and Michelle and others, to come into community with and have some solidarity. And I also think we all need to have community together during this time, that we need to be there for each other, and we need to find the hope. And I would encourage you guys to look at the miracles that are happening. I know it's really hard right now, and it's tough for any of us to scroll through the news, and sometimes hard to believe. But want to encourage you to find those sense of hope, sense of agency, and then really think of what's the influence that you have in your family, in your community, and in your work life, and to really activate that, and to know that there's a lot of concern, but where are we going to where are you going to focus? So I think patience, being in community, and really helping each other, and mentoring and coaching each other, because oftentimes this does take some coaching to get the right language. So, but want to encourage you, it is a life-giving, generative conversation and model, and we need more of it. So thank you.
Thank you so much, Dora, for your pep talk. And I guess go forth with being a steward. And go
I am. I'm going to
up.
go do stewardship, trying to
Shake
build
things up.
bridges
Thank you,
of
Dora.
behavioral health and systems of care in the Inland Empire. So thank you all.
Great, thanks. So Paulette, questions for Paulette. We welcome them in the chat, or feel free to just unmute if you'd like to pick her brain.
Yeah, I have a question. Thank
Yeah,
you.
Karen.
And I'll come off mute just to just to add a new voice. But thank you all so much for your voices. So one thing I've been wondering about in terms of inviting others in and connecting across is how we think across generations. Recognizing, and I'm thinking about you, Paulette, and your work in journalism, how we know that especially younger people, which I am not one of, but there are some here, have different, get their information in different places, in different forms of media. And I'm just curious how you think about that in terms of connecting across and inviting others in and growing the movement, how you think about working with different generations, younger people especially.
Yeah, so what's cool about our team is that we all think about that, and even think about we're from a community that I don't know if I mentioned this or if I was talking to someone else about being a news mirage and not a news desert. We call it a news mirage because it seems like there's more news than there actually is, or access to news than there actually is. And then we're also philanthropy desert. We don't get the same kind of funding that the coast gets. So kind of scrappy mentality. But so it's like a whole team of that. But one of the things that we don't have are journalism programs even in our region. So we don't have, you can't get a bachelor's degree in journalism. You can get maybe a minor in it in one of our universities, but you can't. And we're like, how do we help grow the group of information providers in our region? And then also, like you said, Tara, where people are getting their information. So part of our partner group are actually young folks who have strong followings on social media. One in particular has a Instagram page that's the Inland Empire Instagram page that has tens of thousands of followers, and his primary business, he's a young entrepreneur, and his primary business is like merchandise, selling merchandise that's positive about the region, called One Love IE. So he has storefronts in several parts of our region. He has about 4 now, I think 5 actually. Now he's in our airport. But somebody we brought him in because part of it was to learn from him, but also he's trying to figure out how he could be more helpful as someone who has this Instagram following. How can you provide better information to people, because he already has eyeballs and interest. So and we have another young man who has a podcast, who actually a very successful podcast, several of them, that he just recently sold one. But we're, he wants to learn too, like how he can provide better information. And then we have a young group that's doing media literacy, and they want to work in schools. They have the will, and they have the content, and they have the knowledge, but they don't have the relationships with the schools that some of us have. And so the way we're thinking about it is we bring them in, and they're part of the cohort, right? We've actually granted them some funding to kind of be an experiment with us. And we're like, how do we teach them journalistic principles? And they then have this platform. And then we're also providing some of the journalism organizations also can help provide content on these pages or these sites. So we're or these platforms. So we're thinking about, like, we know where people are, but we also know that there's a lot of crap in social media too, right? Or we have these Facebook pages that are all about crime and traffic accidents and whatever, but to get eyeballs. So we're like, how do we flip that and provide vital information, important information that people need, things that have been vetted. And so we're looking at even creating, and I was just here with some folks from Arizona State University talking about like these boot camps where they don't necessarily need to have a degree in journalism to be able to provide information, civic information that people need, or other types of information that people need, as long as it's well-vetted information, right? And so that's the way we're thinking about it. We also, when we did that initial mapping of our infrastructure, we saw we had like 120 120 plus radio stations in our region. And we're now looking at who owns the radio stations. A lot of them don't provide news, but they have that connection with audience, including younger audiences. And so we're looking at how do we partner with them and do things that provide, once again, the vital information people need. Because they have the kind of platform. So that's how we're approaching it. And we're just, like I said, we're just getting started. So it's been great to have some of those younger voices in the conversation. And they're really happy to even be in the conversation with us, which is great. So we hope to be learning from each other.
Thank you so much. Steve, I saw your hand go up. I just want to make sure we addressed your question or comment.
Sure, thank you. More of a comment. The first is incredible appreciation for this moment. The fact that, one, we need it in this moment, but also I'm in the transportation sector, and I don't know, there may be some undercover transportation people in this audience that I don't know about. But when we talk about access and several of the things that Dora said, they resonated with me because there are folks in my sector. So I work in New Hampshire, but I also work for federal technical assistance centers out of the Federal Transit Administration. We are really trying to partner with sectors because we recognize that we are serving the same clients. And of course, you can't do anything without transportation, even if it's your own 2 feet. So without a safe sidewalk, even, you're not going to get very far. And I think this, unfortunately, this appears a bit novel because I think our sectors have been so separated and we all have the alphabet soup. But what I found in my work in New Hampshire and then my federal stuff is we're really trying to embrace social determinants of health, vital conditions, and using that language, because if you don't get caught up in the ownership of your own language, you start to realize that we're talking about the same stuff. And then the other thing was I'm facilitating a healthcare transportation task force. It's supposed to be upstream, big solutions, and make its way all the way down to where the rubber hits the road. But it's trying to get at these issues. But the points that Dora made about the trust building, meeting people in the hospital sector who are so overwhelmed or operating their hospitals or whatever role they play, and there's a level of complexity with this that it's sometimes hard to think like, why are we going to talk to the transportation people? So I guess there's a message here. Thank you. Paulette, you spoke to several things that I'm thinking about, including getting the message out and how we need those platforms to communicate with the public about what we can do for them. But there are opportunities out there. I'm happy to drop in some resources that might be of interest to this group, including something called the Federal Coordinating Council on Access and Mobility. That is actually a collection of federal agencies, and I realize we're in the upside down now, but this is something that right now looks like it's going to continue, so fingers crossed. But it's been 20 years, and they are bringing state agencies together into communication, but to remove barriers and access. So CDC, CMS for Medicaid transportation, all of those folks are at the table. So we have like 2 groups that are recognizing the problem. And I'm so excited to be in a space where you all get that and are trying to come here. And I think we have to try to do some more deliberate outreach so that people like me connect with people like you and the work at Ripple and doing all of this. So like I said, comment, I'm all over the map, but just really excited about this and really hoping that if I can play any role to help, I'd be happy to give back because you're all helping me to understand this work.
Yeah, I was going to say, Steve, thanks for that comment. That's one thing I really appreciate about that vital conditions framework. I mean, transportation, right, is one of those vital conditions. And so for us, it's allowing us to look across the sectors. And it is giving us that kind of common language. And I know like Dora had to go, but when she'd already been working with some of the health plans and was very familiar with vital conditions. But was on the board of the Community Foundation, and we were doing a separate process. We were like, we did some surveying of our nonprofit organizations, and we were like, what are some of the key issues that we should be looking at? And we called this pillars process, because we just didn't have a name for it. So we were like, these are the important pillars. So we had health, we had all of these, I think we ended up with 5. And Dora said, we really should look at the vital conditions. Like we really, and so we, as a board, we were like, let's look. And so they started, we had a few sessions just with the board and realized that we should make that a region-wide conversation. And so we did it as a part of our policy. We had started a policy summit. And so we made that a part of the work so that now all the entities, including our local government entities, are talking the vital conditions language. And it just really helps in terms of unifying. And we're starting to see opportunities that are being incentivized through grants to work together, specifically on it may be one vital condition, but it's like across sectors to look at that one vital condition. And so we're finding ways to incentivize it through grants and other opportunities. But I appreciate your comments there. And I think at the local level, any opportunities you can find partners, organizations like community foundations or others that do that kind of community work, introduce the vital conditions to them, because it just has resonated so well in our region.
Thank you so
Yeah,
much.
well said.
I am seeing in the chat that there is some very organic cross-pollination occurring. I'm happy to see it. I love to see it. So do check out the resources that are being added in the chat. It is truly a gold mine, and we'll be sure to share out the resources as well. It is nearing the end of our time together, so I need to thank you. Thank you all for engaging in such meaningful conversation together today. Paulette, thank you so much. I know like you ducked out of a conference for this, so your commitment is real. That is just impressive. And all of you today as well. As we leave this space today, please, please, please remember that you're not alone as a steward in your community. Let's turn inward towards each other, and let's keep building this collective hope and resilience for this challenging but oh so critical work. I encourage you again to explore the resources that were included in today's chat. And additionally, there is a SurveyMonkey link included in the chat. As you exit today, please share your feedback. It is deeply appreciated as we plan and design future sessions like this so that we can continue to have these cup-filling and coordinated conversations with all of you as stewards. Thank you again for joining, and I hope you have a great, great day, great rest of the week, great season, great everything. Thank you.
Thank you.